So we are here for vaping and e-cigarettes tonight. This is presented to you by Kathy Schwartzhoff, who is a certified prevention specialist at Helping Services for Youth and Families. And we are doing this in conjunction with a grant that we have with Iowa Department of Public Health. So we're excited you all are here. So what we're going to be doing tonight is, first of all, looking at why are all of us here. Look at some local statistics, because this just isn't from the East Coast and West Coast. It's right here in the Midwest and Iowa and in our communities. Learn more about just what vaping is, what e-cigarettes is about, what the harms are related to those things, and what can we do. And I know that's a lot of what's on people's minds tonight. And of course, we'll hopefully get to some questions that you all have, and you can put those in the chat is a great way to do it, and we will work on as many of those as possible. Colinne's going to help me out by, Colinne McCann is going to help me out by telling me what's there. But we're going to just clip along to kind of get going with things. And some of you may be thinking, like, why is youth mentoring talking about these kinds of things? So I have two wonderful teammates that are going to share about why youth mentoring is involved. And Meg Gelner will talk a little bit first about why we're involved, and followed directly by Colinne McCann. So go ahead, Meg.
Okay, awesome. Thank you, Kathy. And I'm happy to see so many people here tonight doing this. So thanks for being here. Why is youth mentoring involved in this? Well, youth mentoring is about pairing a youth with a caring, consistent mentor that will encourage and guide them and champion them in their own personal walk and talk. And these relationships succeed when there's consistency and genuine kindness and an overall concern for that youth's well-being and their future. So that kind of brings us to number one. We care about kids. That's the long and short of it right there. We care about kids and we care about their futures. According to Iowa Mentoring Partnership, if a child has a mentor, they are 46% less likely than their peers to start using drugs. And drugs start with soft drugs, stuff that's legalized. And so we need to get behind stuff right away and start practicing prevention. Number two, substance abuse prevention is one of our 8 program goals. And Ms. Colleen is going to be addressing what those 8 program goals are. So I'll leave that for her. And then number 3, the current Improving Tomorrow Prevention.
Are we having a party?
Mentoring grant. We are having a party.
We are having a party, Elaine.
Our grant through the Iowa Department of Public Health, they want youth to make healthy choices. So that's why we are here.
And just a reminder, you're welcome to put your video on. That's up to you. We do encourage you to put your mute on right now, unless you're a speaker, and that just helps with kind of additional noises that might be distracting to all. So if you can figure out how to do that, that would be great. Colinne.
Hello. Yes, and as Meg said, we have goals in our program, and the goals are designed to help youth. As you can see, there are 8 of them. Number 1 is have positive relationships with others. Number 2 is increase their self-esteem. And part of why we're here today is because of number 3. And that goal is maintain or strengthen their ability to resist the use of alcohol, tobacco, and other drugs. And number 4, maintain or strengthen their ability to resist being involved in problem gambling, be hopeful about their future. Number 6, increase or enhance their positive attitude towards school. Number 7, provide opportunities to enhance their social skills. And number 8, provide opportunities for new experiences. All of these goals can kind of go off of each other, and the more we strengthen each one of them, the more the kids are successful and the mentors can help them. So back to Kathy. Thank you, everyone.
All right. Thank you so much. So again, we're emphasizing a lot tonight about youth, and I know some of you are here because you cared about an adult who is vaping. And always tell yourself as you see us saying youth, think of because each of us care about someone or lots of people. And so that's why we're here. And to find out more about use in our area, to learn what the products look like and how they're used, and to understand the harms. And I know a lot of you are concerned about that because you shared that in your pre-registration information. And then we want to learn, like, what do we do next? I've got this friend, I don't know what to say or don't know what to do. So before we move on, we are going to do a quick poll. And there's my little dot that says that. Oh, that doesn't look good because it says you are logged in from another device. Your polling session is inactive. Well, then we've had this happen one other time, but we're just going to ask you to think about what's your understanding of this topic, and you can just put your answers in the chat. You know a thing or two could be an option. I understand the basics could be another option. Another one is I've researched this topic. And the last one is I could teach a class on this. So again, I know a thing or two. I understand the basics. I've researched this topic, or I could teach a class on it. Okay. See what we can see. We've got a lot of basics. Researched it. I could teach a class. You do teach a class. There you go. You've done some research. Awesome. Okay, so we've got a wide variety of experience. Looks like some real experts. We've got, I think we've got every kind of folks in here. Okay, so, all right, so we'll just keep trucking along. Thanks for sharing, everybody. That was a brave kind of thing, because sometimes people don't want to say exactly where they're thinking, and that's where the poll would have been great. But sometimes technology doesn't quite work the way we want it to, and we have to punt a little, so there we are. So we're just going to jump right into what is happening in Iowa. And I don't know how familiar you are with the Iowa Youth Survey. It's a survey that's done with 6th, 8th, and 11th graders. And I believe it's done every 2 years with lots of questions being asked about behavior and attitude and kind of how people, the young people, are influenced. And one of the questions was, in the past 30 days, have you used a vaping product? And as this chart shows, vaping use was higher than alcohol and drugs for the entire state of Iowa. And to me, that was a little surprising. I don't know if the rest of you are surprised by that particular statistic, but to me, that was an aha. So it helps to kind of know that. And getting to the next slide here, we've got some information about 8th graders. in Almaquee, Delaware, Howard, and Winneshiek. And I'm not sure where everybody's from, but I'm hoping that most folks are from those particular counties. We in youth mentoring serve these 4 counties, so that's why I intentionally put those particular 3. But you can see that on here, the same question was asked 30-day use by 8th graders in both 2016 and 2018. And comparing those 2 years, the use actually doubled for 8th graders. And it will be extremely interesting to see when 2020 statistics come out to see how that has changed as well. And this slide's looking at 11th graders comparing the same question, 30-day use of a vaping product in the last 30 days for the 11th graders, and their numbers nearly tripled in 2 years. So that just kind of gives you a sense of that there's more products available, there's more normalcy, if you will, that the youth think that this is safe, and sometimes they see that from their peers or from their even from role models too. So kind of thinking about that, advertising is a huge item for vaping industries. And just look at these pictures here. Put in the chat what group, what is the target population here, and what do you see that tells you that? Because I think we can pretty well figure it out pretty quickly what group it is, but what are the key things that influences your saying that? They're very colorful. That's great. Very appealing. There's teen girls. Awesome. Their style of clothing. That's great. Let's see if somebody else says something more specific. Oh, it looks cool to them. Good, good, good. Yes, definitely teens. The way they're dressed, exactly. Young girls. Oh, Andy, great comment. It's cool. Awesome, awesome. Oh, that's great too, Scott. Hip and young. I like that. From the sense that that's very true. And if you notice too, like the gal on the left has her ponytail. She's, you know, showing that youngness and spunkiness, and she's got her little crop top on and her little leather jacket on that just kind of shows that young vibrance, and she looks really healthy. And the gal on the right, I kind of think she's, you know, something to this could be that she's going to take on that city, and she's got a little bit of an edge to her, that she's got maybe not the most common hairstyle for someone. So she's doing it a little different, and she's ready to take on the city. And so there could just be lots of things that we can kind of look at this with to know that we definitely got the idea that it is they're focusing on young people. And I think that's kind of no surprise to us, knowing that the tobacco industry really tries to hook the kids and have them be their new customers and lifelong customers. Unfortunately, their lives get obstructed by some of the use. So the vaping industry really focuses on, when this says those flavors, they're sweet flavors. They also incorporate that they're very cheap to get and easy to get. And then, of course, once they've got them hooked, then that nicotine is needed to kind of continue to serve their addiction or getting their vaping product into their system quickly. So this particular chart just kind of shows you a little bit about the comparison of the amount of advertising dollars that are spent as compared to 30-day use of e-cigarettes. And so as that advertising dollars increases, so has the use. And that just really helps us to know that they're smart cookies as far as trying to get folks to, especially young people, to start. And they're also using the social media, Snapchat, YouTube, Twitter, Instagram, and I'm not sure if I said YouTube, but to get the young people to get started on these things. And once they're started, then they need to use again and again. And like we just said, trying to get them started with something that looks very inexpensive. This shows here that there's 3-pack for 99 cents. Well, who can't have a buck in their pocket, you know? And there's a 2-for-1 special, so offering specials that try to get people to get started. And it promotes impulse buying and gets them going. And a fact I want to share too is in 2019, the National Youth Tobacco Survey, there was more than 5 million youth that reported using e-cigarettes in the past 30 days and nearly 1 million everyday use. So those low prices, offering coupons, sales, specials, all that, it's cheap, you can afford this, you can do it, making it so that it gets in their hands. And then youth too often share devices so that they can cut down on the costs as well. And I believe that each and every one of us has seen vaping products being advertised. They're in convenience stores, they're in pharmacies, gas stations, they're vape shops, and even ordering things online. I just read something this afternoon about a young man that was hospitalized for a long time and in a coma, and he said he never bought things in his community because then his parents would know. He always bought things online, and they didn't even know that he was using. And the other thing, in places that we see in our community, the products are usually very visible. We don't have to work hard to find them, and that avid availability reinforces the idea that this is normal, that it's harmless, and again promotes that impulse buying. So then we need to kind of look at a little bit too the flavors that we just kind of touched on a little bit. E-cigarettes contain pre-filled cartridges or e-juices, and that's what some of these examples are, that the user adds to the devices. And these e-liquids consist of many additives, including propylene glycol, heavy metals, the addictive drug nicotine, and other cancer-causing chemicals. And when the e-juice is heated, a vapor is created, and that can have formaldehyde in it, acrolein, glycerin, and other harmful chemicals. So there's really a lot going on. And another thing that happens, the problem with some of the flavors are meant to be things that originally have been ingested. For example, some of the things that are put in your popcorn to keep it fresh and to make sure that it pops in your microwave, or even your Starbucks drink, those have additives in them that are meant to be ingested into your body, and they're safe that way, but there's no research that shows that it's safe to inhale it and have it be part of your lungs. So, and 4 out of 5 young adults ages 18 to 24 who ever used any tobacco product reported that their first product was flavored. So just an interesting fact to just kind of keep in mind. And this just shows you too a little bit about the, difference of adults and youth, and then 2, gives some examples of what some products look like. They're kind of cartoon type of things. We'll see some real ones here in a little bit, but it also gives you some of those names that you might not be familiar with. Another interesting fact too is that according to the U.S. General, 68% of e-cigarette users in high school are currently using flavor products. So 68% of e-cigarette users. And we talked about that nicotine is certainly part of what is happening in vaping. And vaping products and e-cigarettes have varying amounts of nicotine. And the FDA currently has the authority to regulate the manufacturing, importing, packaging, labeling, advertising, promotion, sales, and distribution of the electronic devices. But right now, the FDA is not regulating the accessories, including the e-liquids. So they're just out there for people to grab. So a little bit about that. And again, too, we're going to talk a little bit about nicotine because it's certainly part of what is happening in vaping. When you use a e-cigarette or someone does, nicotine is quickly absorbed into the body and goes directly to the brain. And a webinar that I was on recently, the doctor was talking a lot about the brain and the synapses, and he said that nicotine actually changes the way your brain forms those synapses and can harm parts of your body that control attention and learning. And you think about youth their brains aren't quite developed yet, that's a huge impact. And some adults too, adults that also affects their brain. And certainly too, it kind of primes their brain too for this whole brain process for setting them up to be using other substances that are even more dangerous. So a little bit more about nicotine. The free-base nicotine is the kind that we may be more familiar with that is used in traditional combustible cigarettes. And it's very blue on the pH scale, which means that it's very harsh or volatile, on the throat when you breathe it in. The other type of nicotine is called nicotine salts, and JUUL found a way to kind of take care of that harshness, and they added benzoic acid to the nicotine, and this makes it more red on the pH scale and helps with that. It doesn't feel so harsh, so the user is able to take in deeper hits more frequently, which causes more nicotine to be absorbed into the brain and at much faster rates. So there's a lot going on in this that we may not have been aware of. And this chart is really interesting. If you even look down that middle column there, you can see lots of different percentages and milligrams and milliliters, and they're just stated a little differently, but that is kind of one of the things that happens with vaping manufacturers, is they sort of want you to be confused. They want you to think that it's safer than smoking cigarettes. So a typical package of cigarettes has 20 cigarettes in the pack and has what's stated here on the chart as far as how many milligrams of nicotine. Then one JUUL pod is an equivalent of one package of cigarettes. Another product called Fix, which you can see it says 1.5 milligrams per pod, or milliliters, I'm sorry, per pod, is an equivalent of smoking getting the nicotine of 2 packs of cigarettes. And then the last one is the equivalent of 3. And interesting too that it's just 2 milliliters per cartridge, 5.4 % nicotine. So this just kind of helps you to understand that it's very very confusing, but also is very potent. So I want you to look at these devices that are here. And this one we were actually originally going to put it in the chat to make it different, but tell me what you think looking at these A through G. Which one of these do you think is not a vaping device? I love the question marks. Oh, and some people aren't quite sure. They all could be. That's a really good point, Scott. Yeah. Okay, well, I will share with you that D is actually not a smoking device. There is no heating element in it presently, but they could put it into their computer system or something like that, but there really isn't, because it's a portal for you to recharge your phone, but it doesn't have the circular kind, so depending on what kind of device they use, that wouldn't be used for that. However, that's very true that youth get very creative with making it work with what they've got. So the other items are things that you're going to see more as we go through things. So, okay.
Kathy?
Yes.
Willie is saying yes, they do in the chat.
Yes, they do. Why don't you go ahead, Tessa, and say what you're... Oh, Scott said, yes, they do. Tell us more about that, Scott. They get creative. That's what you're responding to. Yes, very true. Very true. Yes, great. Well, we love youth being creative, but we really would like them not to be creative based on using a drug that harms them. And that's why we're here. So some of you all may not really know what vaping is, and this just kind of helps to clarify that. Vaping is the act of inhaling and exhaling the aerosol that is produced by the e-cigarette or other battery-powered devices. An e-cigarette, that's a battery-powered vaporizer that simulates the act and the sensation of smoking combustible cigarettes, but does not burn tobacco. And I can confess that I did not know what an ENDS was when I first started researching this, but now I do. And that stands for Electronic Nicotine Delivery System. And that's some of the pictures that we're seeing, and some of the brand names, JUUL, Blue, and we'll get into some others as we go through here. Sometimes my PowerPoint doesn't want to move ahead. Okay, we are going to look at the anatomy of an e-cigarette. And to the left is the mouthpiece, and that's the part where the user inhales the actual aerosol. There's the cartridge, or is also called a pod, and that stores the nicotine in the chemical solution, like we said, e-juice earlier. There's the atomizer, which is the heating element, and you can see that it's kind of like, it almost looks like a black type of thing. and that vaporizes the battery that powers the atomizer. And then the battery is pretty long on this one, and the batteries do, you know, are different sizes based on the type of equipment that is being used and the chemical solution that the person is wanting to control. So, and the other piece that's seen here too is the LED light, which illuminates when the system is actually working and the person is actually inhaling the e-juice, or actually the aerosol, we should say. So there's kind of a argument, if you will, about is it vapor or is it aerosol? And it's interesting to hear what some of the manufacturers say, because those manufacturers want us to think that this is not harmful. And so there was really, they want us to use the word vapor, and they actually introduced that when these products came out, because they actually had two reasons for this. The one was that they wanted it to sound healthy. They wanted it also to seem safe and to be less harmful. The other thing was they did not want it to be identified with smoking, so that it would fall under some of the other regulations that tobacco products have. And so this slide just really shows you that there's lots of chemicals that are part of the aerosol that are really not meant to be in your body, particularly the place that you breathe. And it also affects more than just your lungs. So there's lots of effects that we're going to get into here in a second. Okay, and then want to talk a little bit, here's some different products, what they look like. And you know, that pipe thing, I was like, oh, that's just a pipe. Well, look at that little unit there that's right above, I don't know what you call that, the bottom part. It looks so normal. And you can see too, some of these things look like a USB drive or a pen. Something, a remote control starter. I don't think there's any pictures of something like that right here, but there may be some others later on. They look kind of like everyday items. That one thing looks like a cigar. And so there's lots of intentionality in trying to make it look normal and to be discreet when using these, so that they can be carried in the school hallways, they can be used at home without a lot of questions, and in bathrooms, and people don't really realize that it's anything that isn't normal, if you will. So some of the the brands are, as we stated earlier, JUUL is one. I think Views was shown, or My Blue definitely was earlier. And also disposable kinds of cigarettes, some of the common brands are Zigzag and Mark 10. And so I think it's kind of helpful to just know some of those different kinds of brands, because that may be new to some of us. Oops, it went the wrong way, friends. Sorry. Just seeing if you're paying attention. And want to talk a little bit about tank systems. This again was something new to me. Tank systems come in medium to large devices, and they have little to no resemblance to any other tobacco products, because actually, the reason that I picked that white battery thing is I thought it kind of looked like a tank system, possibly. And they also can be disposable. They can be rebuildable, depending on how it's made. And some of those particular brands are Spoke, SMOK, and Aspire. And they have large batteries. Remember how we talked about those can have different sizes. And then there's vape pens, and they're the medium-sized tank vaping device, more compact. They're relatively easy to conceal, and again, can be very, very discreet when being used. So we talked a little bit about the fluids and how those can be put into the system, and you saw that on the picture of the anatomy of the pen, and then also some of those other products you could see where a juice could be put in. There's also products that everything's ready to go for you. It's kind of like buying a box cake, you know, to make your cake type of thing. It's all ready for you. And there are also, that's another way that this is explained too, is that there's open systems, meaning that the user puts the product in themselves, and then there's closed systems where the manufacturer believes that nobody can get into it, and that's not truthful because those creative people do that. They do get in there so they can reuse that system again and make their money go a little bit further. And these are some other examples of some other products. The one on the left is, it's sort of a newer product, IQOS, which is a heat not burn tobacco product. The middle one is the UITTING Cocoa Pod Amulet Vape Watch. Who would think that your watch could possibly look like that? And then two, let's see. Oh, yeah. The UITTING Cocoa Pod is the one that's on the left. And you can see too, there's varying prices. These may not be today's prices, but they're fairly current. And another thing we want to point out too is that these can be very concealable. Maybe not, I mean, I wouldn't conceal my watch so much, but who would question a watch? But things can fit in everything. They're also pretty sleek looking, pretty modern. So that again, that appeals to younger people. A big question that we want to just really, really break the myth about, can e-cigarettes be used to vape other products? And they certainly can be. Any substance that the user wishes to add, they can and do. And then when they use that word hacked, that is what it means, that they hack into that system and put in whatever they want to. Another big question is, are e-cigarettes safe? And the unquestionable answer is certainly not. And I think we've been pretty clear about that. There are certainly products in there and chemicals in there that are certainly not safe. I know tonight that some of you are from the EMS world, and you challenged me a bit today that I had to look up some new things. So here you are. Wanted to look at what are some things that are really happening here, and doctors, medical people may know this, but we all didn't know it perhaps, that doctors have created a diagnosis called E-Volley, which has the acronym that's to the right there. And E-Volley is considered a diagnosis of exclusion, which means that there's no just tests that you take that says, yes, you have it, or a marker that points that it's a direct diagnosis. And there a total of almost 3,000 hospitalized patients have been affected by E-Volley since February of 2019, or as of February 18, 2020. And that was the most current data that I could get. There were 68 deaths were reported in 29 states of the District of Columbia, and the median age of deceased patients was 49.5 years, with ranging in age from 15 to 75. And with those deceased folks, there often was a gradual onset of symptoms, and not always. And with that gradual onset, 95% of those were respiratory, 85% were constitutional, which I didn't know what that meant, and that means there's lots of systems that this can affect, so that can include weight loss. There was a gal that talked about she lost 50 pounds in a month, a young person. Fevers, headache, chronic pain, fatigue. 77% of those 2,807 folks had gastrointestinal types of things over several weeks. Some of the acute type of things that are happening is that users have sudden pressure on their chest, they're unable to breathe, and specifically that they don't respond to asthma medication, because oftentimes you may think, oh, they're asthmatic, maybe they've never been diagnosed, they can't breathe, I'll give them this, but they don't respond to this. And the other thing that doctors will have said in my research is they're often puzzled when a patient presents to them, even though many times the user says, I have been using a vape product, they don't often associate all of their symptoms with what's going on. And so the health professionals are really often puzzled with what is being presented and may not take it as seriously that it really is about either EVALI or some of the other effects of vaping. So we were going to have a poll for this next one, but we're just going to zip right along and look at some of the ways that you can, or symptoms, I'm sorry, I went ahead too far, I think. Oh, I forgot this part. Some other harms that have happened is there certainly have been burns that people get from the batteries exploding. There's been many poison control calls, house fires related to explosions or injuries have occurred because of those explosions. So there's lots of other things that have happened. And this is what I was thinking was the next one. Things to look for. Dry mouth, light fruity minty scent, unusual devices or unfamiliar products, but now you know some of those. Frequent bathroom breaks. That has nothing to do with your urinary tract. It has more to do with, I'm going to sneak to do this. I'm sorry, go ahead.
Very interesting.
Yes, yes. And then breathing into a sleeve or collar, because these things are so small, people can conceal them really easily. And their head down, facing their lap or their belt area, again, can be just enough to conceal the product so you can't tell what they're doing. And of course, there can be signs of nicotine addiction and irritability, anxiety, restlessness, difficulty concentrating, depressed, their moods changed, being very frustrated when they normally are not, and being very angry. And the testimonials of parents saying they didn't know what was happening with their youth. They thought that they broke up with somebody, or they thought something wasn't going right at school, and then found out that it was all related to using these vaping products. Okay, and that kind of leads us into what can we do about this? And we're first going to talk about youth, and then we'll get more into talking about what we can do if we have a trusted or adult that we want to talk to. But some of this translates to adults too. Share with them any facts that you have from tonight, do your own research, go online and get some information. We're going to give you some good resources to do that. But just provide some facts about what you learned, and you can even start that conversation with, hey, I was on this training and I learned this, or oh, I heard something about this. You can certainly dispel those myths and make sure that they understand that it is an aerosol, it has chemicals. Talk about the marketing, probably more with the youth, but it will also be interesting if you have adult friends to ask them when they started, because I bet they might share that they started when they were younger. And then ask them what they think. What do you think about, you know, this whole vaping thing? Tell me more. And certainly don't wait for the perfect time, because there is no such thing. Do it now. Visit with them. You care about them. That's why we're here. And so we want to make sure that they know, that our loved ones know that we're here. Be open and honest. Don't do the lecture or anything. Be yourself. And after we talk about these laws and policies which do affect adults, we're going to talk more about the adults. I'm going to introduce Tessa Willie, who's the Director of Prevention Services, and she's going to talk about a little bit about state laws and some policies that we need to know about. Tessa.
Thanks, Kathy. All of this information is really great. Now that we're on to the vaping laws and policies, a lot of you have probably heard of something called the Smoke-Free Air Act that started back in Iowa in 2009. And that was when businesses and restaurants and any place of business couldn't allow smoking inside anymore. And something interesting about that law is that it doesn't apply to e-cigarettes or vaping devices. So people could be in a business or a hospital or a school, just for instance, if they didn't have a policy that said people couldn't vape in there, then it wouldn't be against the law. And I work under the Tobacco Prevention and Control Grant, and one of the things that we do is help businesses, schools, hospitals, all of child care centers, all those different places get their policies up to date to make sure that they have the right language in there. And then we're also able to provide signage so the people visiting the business or any place like that has the right signage that says nicotine free. And then we can kind of continue on if they have a lot of employees. Sometimes it's easier to roll it out in steps, and just making sure to support the employees and give them the resources that they need to quit if that's something that they're interested in doing. So that kind of wraps up the vaping laws and policies.
Great. Thanks, Tessa. And then we're going to move into those resources that we want to know. How can we help our, this is the youth one, or I should say the youth one on the left. My Life, My Quit has free consultation coaching sessions. They can text to these particular areas. And by the way, too, if any of you would like us to send you this PowerPoint, I'm more than happy to do that. You can email me, because I all emailed every single one of you, I believe today or in the past couple days, to make sure that you knew how to get on and to welcome you, and just let me know and I'm happy to send that information to you. On the right is the Quitline Iowa information, which is more for adults. Again, free coaching. I have to confess, the first time I learned that there was an 800 number that a person could call to quit smoking, I thought, that doesn't work. They should be working with somebody in their community. And no, The research, and that is effective for many people, but Quitline, Iowa, the nice part of that for some folks is they prefer it be somebody that doesn't know their butcher and their cousin and all that kind of stuff. They want to have somebody that's impartial that can just kind of really help them with something that they're struggling with. So it really does work. Yes.
The other Colinne is wondering if Iowa will add the e-cigarettes to the Smoke-Free Air Act.
And I think I'm going to refer that to Tessa since she knows more about the Smoke-Free Act than I do. Great question, Colinne.
Yeah, so one of the things we are working on is increasing the number of businesses that have a nicotine-free policy across the state. So we are gathering support at the local level to increase those numbers to eventually, hopefully, have that be statewide. I'm not sure if it will go into the Smoke-Free Air Act or if it will be something separate or in addition to, but that's definitely something that we're hopeful for in the future.
Great. All right. And another resource, this is really a great one for adults. They also have things for youth as well, but it's focused a lot more on adults. Your Life Iowa is a resource that you all can go to. And there's wonderful information about alcohol, drugs, gambling, mental health, suicide, and a special section for vaping and e-cigarettes. And this special section was just added in the last year or so. And it's just a great resource to kind of look around and see, get some ideas for that friend that you want to talk to, or some ideas for your son-in-law that you want to talk to about, that you know that they're using and you care about them, and they just have some great resources that we want you all to check out. And that Your Life Iowa is affiliated with the Iowa Department of Public Health as well. So I've used some sources for things, so just want to be ethical and make sure that you see that those are there. Somebody already asked a question. And what other questions do you all have?
We had a wonderful comment by Andy Deering that the best thing they did was no smoking in public places. Me too, I agree.
And if you want to, put your information, your question in the chat, or if you want to just unmute yourself, you're more than welcome to. And I know sometimes when I'm on things like this, I have to think about what I want to say. Then I have to type it. So give yourself some time to do that.
I have a question.
Yes.
Yeah, if the pod or liquid is not fruity or minty, can you still smell the aerosol that's breathed out? I mean, like I can smell a cigarette 2 blocks away. I mean, it's that obvious. But can you smell it if it's not minty or fruity?
There are lots of different flavors, if you will. And so I would say if you suspect something that is an odd smell, it could possibly be that. Yeah. And I know too, we walked out of a wedding venue that we walked outside and we went, oh my. And everybody else said, oh, that's marijuana. And I was like, no, it's not. Based on the smell, it was just like, no, that's not marijuana, but that's a distinctive smell. So, yeah.
Okay, just was curious. Thanks.
Oh, Scott's got a great suggestion here. Try to convince your schools to put vape detectors in your school bathrooms. Interesting. Interesting. Great. I don't know much about vape detectors. Maybe that's something that.
Want me to talk about it a little bit?
Yeah, that'd be great, Scott.
We put those in last year in the high school, at Howard Wynn schools.
Mm-hmm.
We had some students that were actually caught at another high school and found out about these vape detectors, and now we do have them. And what happens if a student uses a JUUL or whatever? There's some of us that get instant notification on our computers or cell phones that that happened, because you know, with those things, they're so easily used, so quickly used. The only really way you can combat the use of it, I mean, obviously education and things like that, but you also have to put an end to it also.
Yeah.
So it costs a little bit of money, so you got to go to your, you know, school boards, or if you can get grants and different things like that. But it has cut down the known use in during school hours, because kids realized they were actually going to get caught. You know, with like back in the day with cigarettes, the smoke would linger and last, and you could figure it out. But with the vape detectors, and you have to couple it with having cameras obviously outside of the bathroom hallways, so when you get the notification, you can figure out who's coming out of those areas.
There's a question, Scott, about, oh, here we go. Do you know how much each detector costs? And someone shared about $1,000 each, Tessa.
$1,000 to $2,000. Yeah.
Okay. And I'm sure there's more sophistication as you go up that dollar range.
That's right.
One person shared too that they're very concerned about the long-term effects of vaping, and somebody else had shared that in the information what they wanted to know today. And that's kind of the trick part of this right now, is that I haven't seen any studies that show after 10 years, here's the effect. We haven't seen anything that's long-term. And it will be interesting to see what that is. The unfortunate part is when there's deaths, you can't see a long-term effect. So, okay, I want to be cognizant of your time because you're taking a few minutes. Oh, that's cool, Meg, to know that in DARE in 6th grade, they did a whole unit on vaping. Awesome. Well, great. Well, thank you everybody for being here tonight. It was a wonderful exchange of information. I really need you to go to this bit.ly address here, bit.ly/vaping eval, and complete an evaluation. For those of you who are EMS folks, you need to send me your email with your full name, your date of birth, your certification number, your address, and your phone number, and then I'll be sending you your link that you need for your eval. But I want everybody to do the bit.ly one as well. So thank you everybody for being here. My email is Kathy S, Kathys, not like it's in the chat, it's like it is on the screen. So, and again, you got an email from me. Thanks everybody.